A scaphoid fracture of the wrist is a challenging injury, especially when it's missed with the patient assuming he or she just suffered a sprained wrist. In this video, I'll discuss what the scaphoid is, why proper diagnosis is essential, and what the treatment options are. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. Now, a scaphoid fracture is a difficult problem. In case you're wondering what this is, if you look at my model of the wrist, on the side of the wrist where there's the thumb, there's this bone right at the base of the wrist there. That's called the scaphoid. And if you were to sort of stick your thumb up and you see these two tendons sort of running along the base of your thumb, in between those two tendons, if you push straight down, you feel sort of a bone down there. That is the scaphoid. Very often it's a fall on the wrist that typically causes that injury. And a lot of times people assume they just sprained it. They don't see anything out of place. It's just sore and stiff and they don't think much of it. But that's potentially worrisome if you broke a scaphoid rather than spraining the wrist and some minor injury. But if you broke that scaphoid, that bone down here, the problem with that is that scaphoid has a very tenuous blood supply. And if it's not lined up properly, that bone can basically die. And then that leads to fairly significant post-traumatic arthritis in the wrist that can become a big, big problem right away. So if you've got pain at the base of your thumb after a traumatic injury, it's always a good idea to see an orthopedic surgeon, see a hand surgeon, get x-rays of it, make sure you know exactly what it is. And if it's a scaphoid fracture, then it involves basically treatment to get that to heal. Occasionally, that could be if that fracture is basically perfectly lined up. There's no step off or no displacement at all. In theory, you could do a cast that holds it in place for 6, some people do up to 12 weeks. The trend seems to be getting to do that, to fix that, even non-displaced ones, surgically to make sure it heals in the proper position. If it's out of place, if it's out of alignment, the surgery is going to be, the hand surgeon goes in and opens it up, lines the pieces of the bone back together, and then puts usually a screw across it and gets it to heal. So more often than not, a scaphoid fracture is going to require surgery. Now, even with surgery, there's a risk of avascular necrosis, basically that bone dying due to the blood supply, but that risk is a lot lower surgically than non-surgically. It's something that following it with post-operative x-rays multiple times while it's healing to make sure it's healing correctly would be important. But you want to minimize the risk of long-term issues in terms of that bone dying or not healing, also developing post-traumatic arthritis. So very important to see the surgeon. As far as recovery from that surgery, it's sort of the typical when you're talking about a fracture around the wrist. Some kind of immobilization for a period of time to keep that bone lined up while it's healing. Then the immobilization comes off. A hand therapist can help you work through range of motion and strength and get back to the activities you want to do. But even though that's probably an outpatient surgery, you're talking about a long, long recovery until that feels normal. Now, I'd love to hear about your experience with your wrist injury. Leave those in the comments below. Just understand, if you leave a specific medical advice type of question in the comments, I can't offer you medical advice. So what I do is I try to address that topic in future videos. Make sure to subscribe to my channel, click the bell to be notified when I release a new video or when I start another live stream like my Ask Dr. Geier live shows. Thanks so much for watching. I hope this video was helpful, and I look forward to helping you feel, look, and perform better than ever.